So today we'll read about growth and development. So growth is basically quantitative, that is increase in size or increase in number of cells, increase in intracellular substance. But development is quality, means maturation of functions, for example myelination of nervous system. So what affects the growth? The factors that affect growth are three main factors: the fetal growth, the postnatal, and social factors. So fetal growth, the genetic potential. For example, tall parents will have tall children. Gender: boys are generally taller and heavier than girls at time of birth. Then fetal hormones. Human fetus secretes thyroxine from 12th week of gestation. And thyroxine and insulin have an important role in regulating tissue acceleration and differentiation in the fetus. Next, fetal growth factors. So, large number of growth factors are synthesized locally in fetal tissues and act principally by autocrine and paracrine mechanisms. The insulin-like growth factor 1 and 2 are among the most extensively studied fetal growth factors. The placental factors. The placental weight, the structure of placenta, functional integrity of placenta are important for fetal growth. Then maternal factors are very important. Whether the mother is teenager or advanced age, whether she had recent pregnancy or high parity, pregnancy induced hypertension is present, various infections, acute and chronic, can affect fetal growth. Anemia in pregnancy, smoking, and alcohol in mother affect fetal growth. The other important factor that affects fetal growth is postnatal factors. These are genetic factors, for example, Down syndrome or Turner syndrome can affect growth. IUGR, intrauterine growth retardation, and then hormonal factors again postnatally also affects the growth of the baby. So normal growth cannot proceed without the right milieu of hormones in the body throughout childhood and adolescence. Next is gender. The prepubertal growth spurt occurs earlier in girls, however, their mean height and weight in girls are usually lesser than those in boys of corresponding ages at the time of full maturity. Nutritional factors are also very important postnatally that affects growth. These are calcium, iron, zinc, iodine, vitamin A and D are closely related to disorders of growth and development. On the other hand, overeating and obesity accelerates somatic growth. Other important factor that affects postnatal growth is infections. Most common are diarrhea and recurrent diarrhea especially, and respiratory tract infections that cause growth impairment. Systemic infections and parasite infections may also be related with velocity of growth. Next is trauma. Trauma, in the sense a fracture at the end of a bone, may damage the growing epiphysis and thus hamper the skeletal growth. Chemical agents. For example, if you administer androgenic hormones, they will initially accelerate the skeletal growth. However, androgen causes the epiphysis of the bones to close prematurely, leading to early cessation of bone growth. Another factor that is very important factor that affects growth in children is social factors. In those, socioeconomic level. Children from families with high socioeconomic level usually have better nutritional status. They suffer from fewer infections because they have better nutrition and hygienic living conditions. Poverty. On the other hand, poverty, there will be hunger, undernutrition, and infections. And that these all factors cause poor growth. Natural resources. Natural resources means if there are natural resources that encourage industrial and agricultural growth in the country, that causes improved nutrition of the children in the community. Climate. Climate also affects the growth. The velocity of growth may alter in different seasons. For example, usually the growth is higher in spring and lower in summer. Infections and infestations are common in hot and humid climate. Weather has also a very important role, for example, on agricultural productivity. Readily available food and capacity of strenuous labor by the population. Then emotional factors. Emotional factors means children who are from the broken homes and orphanages do not grow and develop at an optimal rate. Anxiety, insecurity, and lack of emotional support and love from family prejudice the neurochemical regulation of growth hormone release. Parents who had happy childhood and carry a cheerful personality are more likely to have children with similar countenance. So, emotional factors are important, but usually they are neglected. Then, cultural factors. In some communities, methods of child rearing and infant feeding are different. So, there may be religious taboos against consumption of particular types of food that can affect the growth, nutritional status of children. Parental education is also very important. Mothers with more education are more likely to adopt appropriate promoting health promoting behaviors which have had direct indirect influences on growth and development.